Uh, Hello, hello. We're here with Dr. Holly Richmond, a good friend and colleague and Associate Director of Modern Sex Therapy Institutes. I'm so excited that you are here to talk to us about somatic sex therapy. We've been hearing a lot more about somatic therapy and sex therapy and how they go together, and how important it is to be trained. So tell us a little bit about what is somatic sex therapy?
So, somatic sex therapy is really the psychophysiology of sex. So, all of us who are sex therapists are obviously licensed clinicians in some way, psychologists, marriage and family therapists. But to me, it didn't make sense for me to study sexuality without adding on the somatic piece. So, I got my PhD in somatic psychotherapy to really understand how the body functions during sexuality. And of course, Rachel, it's not about performance or what the body does necessarily, but what the body holds, what the body expresses. So somatic therapy is really looking at the meaning that our body, like what are the messages our body is trying to tell us?
Amazing. And how does it work? So what are some techniques that you use? Who is a good candidate for somatic sex therapy?
Yeah. So I'll start with the second question. Who would be a good candidate is someone who can talk very well about what they're experiencing, but doesn't really have a bodily connection to it. So there's not a lot of emotion in it. They know cognitively this is happening, but they don't feel like they've cracked the shell of really understanding themselves. So what we're going to do is bring in some somatic practices with that. And that can be during sessions, or for me, I'm always giving homework. So it would be practices that they would do on their own. Sometimes these are sexually based practices, but a lot of the time, especially at the beginning, it's just movement based practices. So, how do we get someone in their body really in that empowered and embodied sense?
Awesome. And so tell us what are we going to learn in this class and what do you think the takeaways will be?
Yes, so we're really going to get the foundation of somatic psychology. So this is the psyche part of it because all of us in this profession, we are not touch practitioners. So we're really going to understand the foundations of how does somatic therapy work and how do I apply it? A lot of that, Rachel, is through nervous system regulation. So I'm going to teach my way of understanding the nervous system, very simple, something that I do each and every session with my client. And then we're going to go to the leaders in our field. So we're going to look at Carolyn Braddock and the Braddock Body Process, polyvagal theory. We'll look at Stephen Porges's work and Vander Kolk's work and some of the other leaders. But I also like to bring in dance movement therapy, yoga, and breath. So we're going to be talking about all of those things. And then towards the end of the 4 hours, we're going to look at those referrals. So people that sex therapists would refer to that can touch or that are more body-based in practice. So it might literally be a somatic dance practitioner, surrogate partner therapist, or sexological body worker.
Awesome. And for people that, because I hear a lot with my clients, like, there are certain people who just don't feel like they're in touch with their body, right? I don't know what I'm feeling. I can't put words on where I'm feeling this in my body and how I'm feeling this. How do you work with people like that using somatic sex therapy, or are they just not good candidates?
No, they are very good candidates. And again, it would start with some kind of movement practice or just gently, not even like, I don't love that question, where do you feel it in your body? I think it's okay, but I think it's overused. I'm more interested in the experience of them being in their body. So are they hyper regulated or are they hypo regulated? That's the first place we're going to go. How do they know? So Rachel, you've heard me say this a million times. In somatic therapy, we almost never ask why, we ask how. Why is here, and it keeps us in our story. How is process oriented, and we can really understand what is my body trying to tell me. And I share this in our classes, but part of the reason I got into this work is because I was a somaticizer. I didn't have that word back then. All I knew that was my body was running the show and it felt like it was going without me. And I didn't have any control under all of these things that my body was saying. So my body was much smarter than my brain is, probably still is. But when you really learn to frame the body and nervous system kind of in this collective experience, things start to feel much more in control. So I know for the lot of the clients that we see as sex therapists, their body feels out of control in some way, whether it's sexual dysfunction issues, compulsivity issues, pain issues. A lot of these will have a physiological underpinning, but a lot of them simply have a psychological underpinning. So it's really like tweaking, figuring out what part is the psyche, what part is the soma.
Yeah, it's so beneficial for so many people. So, thank you for all that information. I'm so excited about the class. I always learn so much from you. Anything else you want to add that you think would be helpful people to, decide if this is a good class for them, or, if this is something that could help them with their clients?
Yes, it's going to be good for anybody. So I really do. I go foundational 101, somatic psychotherapy, and then we go through some of the also like the foundational sex therapy practices. So we're going to talk about sensate focus, but then we're going to level up and talk about tantra, sexological body work, surrogate partner therapy, and those collateral resources that we so often use. And I think, over the years teaching this class, a lot of our students still don't really know how those collateral resources can support our clients, how to find them, how to resource them. So that's certainly a huge part of this as well. So I think this class would be appropriate for everyone, whether you're an experienced clinician or really just dipping your foot in somatic psychotherapy.
And I just want to hit on one more thing that you did say that I forgot to ask you more about. You mentioned polyvagal theory. Can you briefly just explain what that is?
So polyvagal theory is really the science of connection. Like that's how it's broken down. And what we're doing is using the nervous system to regulate either up or down to a place where we can connect, where we can feel safe. It's very hard if we're in chronic anxiety or chronic depression to connect authentically. So we'll just be touching on the basics of polyvagal theory and how that specifically applies to the body.
Yeah, I think that's so important. Well, thank you so much, Holly, for being here. I'm excited for the class and always enjoy talking to you.
You too. Thanks, Rachel.